have noticed last few weeks, the situation is becoming from bad to worse, and there's serious cause for concern. In some states in particular, there is a huge cause for worry, but I think no state and no part of our country, no district, no zilla should be complacent. Because what the trends show is that the virus is still very active, can penetrate our defenses, and when we think we have found ways to control the virus, it strikes back. It has done so in our country, and it has done so in other countries. And therefore there is a concern which we all should be mindful of. We have seen that the active cases were down to about 1 lakh, just above 1 lakh, and now they are 5.4 lakh. Of course, almost 2/3, 63% are in one particular state, and that too in a few districts of that state. But the fact is, it is a 5 times rise, more than 5 times. The new cases used to be about 9,000 per day, and day before yesterday, it was 68,000. Yesterday, 56,000. Maybe people have been responsible during the festival season, only time will tell. So that's again 6-7 times acceleration. That's huge. We have taken pride as a nation that the case fatality rate has been low, and thank God it is still low. But from 77 deaths per day, as low as 77, now we are witnessing 4 times that number. 271 is one number last couple of days. So clearly we have to be very, very vigilant. And not only in those states where the battle is raging, Maharashtra, Punjab, other states that we discussed at length, but in every state of the country. Because if it is there somewhere in our country, it is there in the entire country, this virus. If it is not eliminated from every village and every city, every district, every state, it is not eliminated from the country, it will hit us back. So, in that regard, we reported to you an emergent meeting that was taken at length, and we highlighted the approach that was communicated in fullest earnest to the states, and we are following that up day on day basis. But I want to emphasize the fact that without effective contact tracing, without quarantining the contacts, and wherever cluster of cases appear, without creating zones of containment, without isolating those geographies, we allow the chains of transmission to be active. And the virus then has its own run. And then things go beyond a certain level, things become out of control. So, Secretary Saab has highlighted how we went through all the tools that are available to control the pandemic systematically, with special emphasis on containing and suppressing the chains of transmission through effective contact tracing, containment efforts, surveillance efforts, protocolized management of positive cases if they are at home so that they don't infect other people, protocolized management of contacts if they are quarantined so that they don't infect other members of the family potentially, and they are not infecting people in the society. These are critical principles. And also, this vaccine, the mask vaccine, social vaccine, as you have heard us speak from here, a name given by our Secretary Saab, Rajesh Bhushan, thank you. The social vaccine is also 70% protective. That's what Dr. Bhargav tells us from science data. 70%. Same as the biological or pharmaceutical vaccines. Why have we become lax about it? Why? Can you please join hands with the government to please bring back compliance with the masks? We can have all the vaccines in the world, but we will for a long period of time need to be also dependent upon masks to protect us, protect our families, protect this community. So the message today is somewhat somber to say that we are facing increasingly severe or severer intensive situation, more so surely in some districts, but the whole country is potentially at risk, and therefore all efforts to contain, to save lives should be taken. And today we come back to also remind ourselves that our hospital preparations and ICU preparations, which we talked long back ago because things were under control, have to be reminded that we have sufficient capacities in our hospitals, our ambulance system is functional, our ICUs are functional, dedicated hospital setup that was instituted in this nation hugely and escalated and scaled up very rapidly must be re-energized, retested, rehearsed, so that when the load of patients will come, we are able to manage it effectively. Remember, if the cases are more, they will eventually overwhelm the system. They'll put pressure on the system. The deaths will also occur. Even if it is low, proportionately low, the deaths will also rise. So we cannot accept the situation. We have to respond. If it is business as usual, we will continue to be chased by the virus rather than other way around.